Hey everybody, this is Dr. Ben Pearl with FitFoot U. So today I'm here with John Luck at the Run event in Austin, Texas. And we were just talking informally about some of the challenges with patients, customers that come into either our retail or medical clinic space and don't understand the importance and the value of a good shoe and some of the parameters of distinguishing a good shoe from a garbage shoe. John, tell us about it.
Well, we try to educate our patients in addition to putting them in the right product. And one thing I'll say to people that have, forefoot disorders, or been referred that have bunions or, tendonitis, is, with all of your footwear, do the tip test. Just simply push down on the sole of the shoe. The higher the heel pops up in the air, the more likely it is going to take you through the full range of motion without your foot having to work and flex and be painful.
Can I ask something with our aging population and neuropathy? Because I do have some folks that with their balance, this is an affront to their senses, so they have to accommodate to it. What's your transition for that type of patient? Maybe not quite Parkinson's, but something going in that direction.
Well, when balance issues come in, I'm looking at the width of the midfoot, just a more stable platform to try to help out. One thing that I try to tell people about is if they have a more flexible or flatter foot, the twist test. The less you can twist your foot, the less you can twist your shoe, the better. A shoe that you can ring up like a washcloth isn't doing anything for you. And the older your shoes get, the more likely you can twist them easily. And it's important to rotate your footwear and stay in a fresh pair of shoes that's doing the job that it's supposed to do.
Last question for you, and I'm going to throw this out. So I was in Alaska on vacation, and I felt like with the prevalence of Walmarts and working hard scrapple, blue collar folks in Alaska, the Skechers seems to be the state shoe of Alaska. Although it may serve some people, what's your thought process for somebody with knee issues, maybe 30 pounds overweight, 40 pounds on a factory floor? What are the strengths and weaknesses of a shoe like that?
So I think you can take a bad shoe and make it better with an insert. If you have a more rigid insert and you put it in a shoe that's flexible and try to twist it, you'll get a better result. You can find inexpensive footwear that will do the job, but you got to know what you're looking for, and still getting, podiatry, physical therapy, a proper fit at a shoe store. Spend a little time and gain the knowledge, and then you can apply that knowledge to lower price footwear if you need to.
I love it. Thank you so much for doing this, John.
Thank you. Yes.